So after the patient is sitting on the table, I usually have them lay down, turn onto their left side, and bring their knees up to the fetal position or at least into 90 degrees. This is going to make it easier for you to do your test. So first we're going to do a digital rectal exam. So you just get a little bit of lubrication. Feel the patient at rest. Then go ahead and have them squeeze your finger. You go ahead and squeeze. Then you go ahead and have them push. Okay? So now coming back to this test, I get my larger syringe and I go ahead and twist it on. Now I like to remove all the air that might be in the balloon just for the comfort of my patient. So I just go ahead and make sure all the air is removed. And go ahead and put that in the locked position. I go ahead with a 4x4 with just some lubrication on it and get the catheter all lubed up. And then with the P that you can see on the catheter here, facing towards the back of the patient, I just go ahead and insert it. So just right into their rectum. Nice and easy. And there's some numbers here and you want to get it to the point that it's at 0. I like to cover them back up for privacy purposes. So now we're all ready to begin our test. I'm going to go ahead and I'm going to put 10 cc's of air into the balloon just to prime it. So I'm going to pull back 10 cc's. I'm going to move my catheter in 1 centimeter according to the numbers that you'll see, keeping the numbers facing towards you and P towards the back of the patient. So I'm going to adjust it here, push up 1, confirm the position, and run it again for 20 seconds. I'm going to go back to the resting test one more time. Move my catheter position to 2, once again keeping the P posterior. Confirm the catheter position and run it one last time. So I'm going to go ahead and confirm my catheter position. So I'm going to put 1 centimeter at the anal verge. Go ahead and cover up for privacy. Confirm the catheter spot. John, I'm going to have you squeeze as though you're trying to prevent yourself from having a bowel movement, as though you're trying to keep your stool in. And I'm going to do it for a total of 20 seconds. You understand?
Yes.
Okay, I will count you in. 3, 2, 1, and squeeze. Squeeze, 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 hard as you can. 2, 1, and relax. So for this next test, I want you to push as though you're trying to have a bowel movement. We're going to once again run it for 20 seconds. Confirm my catheter position on the screen. And then you'll get the green arrow. 3, 2, 1, and push. Push, push, push. Push, push. 3, 2, 1, and done. Next, we're going to put some air into the balloon, and we're going to do the expel test with 50 more cc's of air. So I go ahead. So I tell the patient you may or may not feel the balloon, but I am going to put some air into it, and they may feel it in their rectum. And then go ahead and lock it with 50 cc's. On this screen now, you have to confirm that you put 50 cc's of air in, and you're going to confirm that it's still at 1 centimeter, which is what we're using for this test. Sometimes it will be different. And then after you get your green arrow, you'll be ready to go. So you're going to push again against the balloon in your rectum for a total of 20 seconds. I once again will count you in. 3, 2, 1, and push. Push, push, push. 2, 1, and done. Now we're going to go ahead and do the sensation test using intermittent distension. I've confirmed that the catheter is at 1 centimeter at the anal verge for this patient. The balloon is already primed with our 10 cc's of air, and then I've put 10 cc's of air into the syringe here. I'm going to go ahead and hit run. I'm going to insert the air quickly and remove it quickly and ask the patient to let me know if he felt it. Do you feel that?
Yes.
I'm going to go ahead and hit my sensation button and mark that there was 10 cc's additional of air inserted. Now I'm going to increase my increment by 30, bringing it to 40 cc's. I'm going to go ahead and put the air in. I want you to let me know if it feels like you have to have a bowel movement, but that it wouldn't be an emergency. You could hold it, but it does feel like you have to have a bowel movement. Do you understand?
Yes.
Okay. So I'm going to put in my air. Does it feel like you have to have a bowel movement?
No.
And I'm going to remove it. I'm going to put 30 more cc's of air. I'm going to go ahead and put in the air. Does it feel like you have to have a bowel movement now?
No. Close, but no.
I'm going to remove the air. I'm going to put in 30 more cc's of air.
Yes.
All right, I'll mark my desire and insert how much air I've inserted. Now I want you to let me know when I insert the air if it feels like you have to have a bowel movement and you'd be searching for a bathroom. You would get up and go and use the restroom right away. I'm going to insert 30 cc's more of air. I'm going to go ahead and insert the air. Does it feel like you have to have a bowel movement?
Yeah.
Okay. I tap the urgency. I'm going to go ahead and remove the air and put 30 cc's more up here. And then we're done with this test and we move on to the next one. And then we go ahead and move to the next test. I like to make sure I have all the air out of the balloon. We are going to reprime it with 10 cc's. I'm just going to check my catheter position, reinsert 10 cc's of air so that it's primed, confirm my position here, and then we go ahead and run the test. Now I'm going to have the patient cough. Go ahead and cough. All right, cough for me again. One more big cough, as big as you can go. There we go. And that would be the end of the test. Now that we're done with all the testing, I'm going to go ahead and make sure all the air is removed from the balloon. And then carefully just remove it from the patient's rectum. And this is disposable. Go ahead and get rid of it.